Greetings everyone. My name is Dr. Sunil Karanth, Chairman of Critical Care Services at Manipal Hospital's Old Airport Road. Intensive Care Unit, in short what we call as ICU. The very word ICU sends ripples and fear down the spine of most of us. I'm here to just break a few myths about what ICU is all about. First and foremost, we need to understand what an ICU is. It's an area where we designate a specific area of the hospital where we have a highly specialized team of nurses, doctors, allied specialists and others to help take care of our sickest patients. It's important to understand that ICU doesn't always mean end of the road. That's a very common myth that most people in general public have. So ICU is a place where we admit patients who are very ill, who need different kinds of support, less often so, but more often patients who generally might need some monitoring or a little bit of support for different organ systems and a little bit of caring and close monitoring. So even in what we call as high acuity ICUs, which deal with extremely sick patients, there will be only about 20 or 30% of patients who remain very ill. But on the other hand, majority of them are admitted for close observation, monitoring, minimalistic support so that we alter the physiology, give the body time to heal and get them to get better. Less than 1 in 5 patients actually do badly in the ICU because they come in very, very sick or they are so ill that they don't respond to the different kinds of support that we talk about. So for a person who is outside the ICU, it's always very scary when our near or dear ones are inside the ICU because it's difficult for us to understand what's going on within. Most ICUs these days, including the ICU where I work at Manipal Hospital, even what we would consider as a high acuity quaternary level ICU, which is one of our ICUs, we still have a significant amount of liberal visitation policy. So we do allow families to come 3 to 4 times a day, sometimes stay with the patient, especially if it is an elderly person, if it is a recovering patient, if it's somebody who is very unwell, little children. All these are patients in whom we allow the families to spend quite a bit of time. So gone are the days when we would say that there is a complete barrier between patients within the ICU, their families sitting outside, and most importantly, it's very important to have a well-oiled intensive care team whose job is not only to take care of a critically ill patient, but also with that comes the additional work of taking care of the family, the emotions of the family, the burden of the family, and of course the emotional needs of the patient as well.